You want to start it out? Oh man, am I ready? Okay. What's up, everyone? Well, no, that was too like 1990s. Hold on, let's try again.
What's up, everybody? How's it going? Welcome to Dr. Shaw, Dr. Maxfield's Playhouse.
What? This is Blue's Clues? Okay. Oh man. All right, ready? Let's do this cool.
What's up, everyone?
I'm Dr. Maxfield.
I'm Dr. Shaw, and welcome back to our channel, Doctorly.
Today we're going to be talking about some of the things we've learned, some of the things we've heard, some of it's from our mentors as we've gone through training over the years, some of the things we've picked up on our own.
Little gems of knowledge that people have said to us that just really stuck and changed the way that we think about our skin. So we're going to be telling you what we've learned along the way, and hopefully some of you will find it helpful.
We have 6 tips. We wanted it to be 5, but we just had some good ones that we had to share, so we moved that up to 6.
Really, he had 3 tips, and then I was like, well, I can't be outdone, so I gotta have an equal amount of tips, so we changed it
to 6.
So the 6 best skincare tips that we've heard, here we go.
Here we go.
So tip number 1, brands are not good or bad, but products are good or bad. So what do I mean by that? So a lot of people will say, well, is CeraVe a good brand? Is Cetaphil a good brand? They have good products, and some brands have more good products than bad products. So there's like a little bit of a ratio that goes on with that. So there's certain brands that you can just rely on will make really good products. But then there are other brands where it's sort of mixed. And so if I say that this product from Cetaphil or Neutrogena is a really good product, that doesn't mean that I like everything that they have and that everything that they sell. And I think the perfect example of this is Neutrogena, because Neutrogena has some of my favorite products. They make excellent skincare products. The Hydro Boost line is one of my favorite lines of products in skincare. They came out with new PHA cleansers this year that I really like. But then there are products from Neutrogena that I absolutely hate. Like, I think they're just total trash. And so really it comes down to the individual product. So you really need to look at each product individually and decide if it's, one, a good fit for your skincare routine like we talked about in the past, link above, but also whether or not it's actually a good or safe product. So you really need to look at each product on an individual basis.
All right, example of this. So Neutrogena, I'm always trying out sunscreens. I'm a very active person, so I have like a very specific thing of what I'm looking for in an active sunscreen. And
we get it. You work out. We get it.
No, I'm not working out. I'm outside in the forest. I'm playing in the water. I'm drowning on the shore.
You almost killed me one time when we were surfing, so.
Amazing story behind that, but anyway. So with the Neutrogena, they make the sheer zinc, and I love it. So what I do, okay, whatever, he made fun of me, but I exercise, go running in the morning, and then I'll actually go surfing on Saturday mornings after that. And this sunscreen is amazing. It will stick with me through all that, doesn't burn my eyes. So I'm like obsessed with this sunscreen. I'm always looking for great sunscreens for outside.
So this sunscreen is a terrible white cast.
Terrible white cast.
Terrible. So
really
I hate it. So sunscreen a lot of times comes down to preference at the end of the day. So for that particular sunscreen, he loves it. He raves about it all the time. I absolutely hate it. Would never wear it. So sunscreen's a lot of time going to come down to preference.
And then a perfect example though of just the brands versus brand products that they make is Dial. They've really, I think, done an awesome job adjusting to what I think we're often talking about, and that's like sensitive skin.
Right, so there are products or brands that historically make products that were really stripping, really damaging to the skin, really drying, and then based on feedback have changed the way that they sort of look at things and have started to remove fragrance from their products, have started to remove some of the more stripping and irritating ingredients from their products. And so you always have to remember that brands are adaptable. They're listening to feedback from the skincare community and they're always changing. And so I'm always open to giving brands new chances. Now, if I say one product is good from a brand, that definitely does not mean I like every product from that brand. I mean, there's just so much variability. There's certain brands where I feel like I can just like grab the product and pretty much know what's going to be a good product. First Aid Beauty is one of them. Paula's Choice is another one of them. CeraVe is another one of those. So there's a couple brands where I'm like pretty reliably, but even those brands, within those brands that I love, there are still products that I hate within those brands and would never use.
And as we grow with the channel, I actually think we're very thankful for brands who do take time to adjust like that, who do put research behind their product, who make products with proven efficacy, proven effectiveness. And I think as we adjust, we're going to keep helping promote people and companies who are doing great things and putting things out there that work.
Exactly. Yeah, we definitely want to highlight those types of products because it's a good effort by these brands to actually change the way that they do things. And if they have a good return on investment, then they're going to be more likely to push things and
Right.
make things like that, right? So really you want to cherry pick from brands. Like you don't want to just have one brand because there are certain brands that make the best vitamin C or the best hyaluronic acid, and they're usually not the same brand. And so you just want to pick and choose the best products from each product line. So your cleanser may come from CeraVe, your sunscreen may come from Elta MD, and that's okay. So really you just want to look at individual products, not necessarily individual brands, and make your skincare routine like that.
All right, so tip number 2 is don't neglect your neck. Don't forget about your neck, this décolletage area. Pretty sure I used that right.
He did. So the tip is really protect your neck. You didn't expect that one coming.
I did not. By virtue of what we do and the patients we see a lot of skin cancer, we see a lot of sun damage, and even when people go through very extensive anti-aging regimens, including from topicals to procedures, one area that often gets missed and sticks out like a sore thumb is this area. We see the same, and you'll see the same changes over time that you'll see on your face here. You'll see dyspigmentation, you'll get dilated blood vessels, you'll get skin cancers, thinning of the skin, everything that you don't want here will also show up here, and it just becomes really apparent over time, especially for like this group of people who's probably very proactive at protecting their skin. This is gonna look 20, this is gonna look 50, and it's gonna stand out. Like even now, you see this part of my chest, and a lot of people wear low-cut shirts frequently. So with that, you need to be using and can use most of your active ingredients. You can carry over most of your skincare regimen from your face onto your neck. And that means your retinoids, your niacinamides, your pantothenic acids, your moisturizers, and especially your sunscreen should all fall there to protect that same area.
Now the question is, do you need a special line of skincare products, a special neck moisturizer? Is your retinoid safe for your neck? So this area is a little bit more sensitive than the face. It has less sebaceous or oil glands, it has less hair follicles, and so the skin's ability to repair itself is a little bit less on the neck. Not tremendously less like the eyelids are, but a little bit less. So you just want to be a little bit more gentle on the neck, but most of your skincare products are going to do perfectly fine on the neck. And just this area here as well, we do see a lot of damage on this area. The important part about this is that we can operate on the neck and on the face. There's a lot of tissue laxity that we can play around with, and things tend to heal really well, even if you do end up with a skin cancer on your neck, unfortunately. But the chest area, very difficult area to operate on, and can actually leave really bad scars. And so I definitely think that if you are going to protect one area with sunscreen, the chest is one of the most important areas because it's just difficult to operate in this area and hide a scar in that area.
Yeah, that's true. And this area is like very prone to keloid, and you get hypertrophic scars there when you wouldn't anywhere else on your skin, even for some people.
So as we age, some people actually get these little squares on their neck almost. They're like geometric almost, and it's called cutis rhomboidalis nuchae, and it's very common, and it's due to sun damage. You often see it on the back of the neck, and so that's one sign that you're definitely getting way too much sun on your neck.
Yeah, absolutely. Ooh, and a great idea to contrast actually the sun damage versus normal skin, and we'll show you a picture of something called poikiloderma chavat. What happens is you get the same pigmentary, all the sun damage here, but right under the chin is spared. You can just directly see how much different the skin looks from areas that are protected versus sun exposed.
So protect your neck.
That's it.
So tip number 3, sunscreen is like insurance for your skin. What do I mean by that? So you're not going to go out and buy a Ferrari with no insurance policy, right? You're not going to make a huge investment and then completely not protect it, right? So everything that you do in skincare, from procedures at your dermatologist's office, Botox, filler, laser, microneedling, big investment. Skincare products, you're investing a lot of your time and a lot of your money in it. So if you're not wearing sunscreen, you're literally erasing everything that you're doing. So sunscreen is like an insurance policy. Nothing we say matters unless you're wearing sunscreen, and it makes a tremendous difference as you age. And I've seen this in people that have started wearing sunscreen since they were in their 20s, which was sort of a novel concept for people that are now in their 60s. 40 years ago, people weren't wearing sunscreen. But there are a couple of dermatologists that I know that learned about sunscreen when they were in their residency programs, when they were younger, started using it when they were 20s, and now they're 60. Skin is 30 years younger, no skin cancers. It's the best thing that you can do for your skin.
And we get a lot of questions about hyperpigmentation. And we say this probably almost every time we bring up the topic. If you're trying to treat hyperpigmentation, but you're not protecting your skin from the sun, it's done. It's over. It's a lost cause. Just hyperpigmentation, especially the sun, will just flare it right back up and undo everything you're doing.
So we'll do like a sub tip here. Tip 3B. That's going to be what's sunscreen, like what's the best sunscreen, right? We get this question all the time, and we just kind of went into it. His idea of what a good sunscreen and my idea of what a good sunscreen is completely different. The thing is, the best sunscreen is the sunscreen that you are going to wear every single day. You, not me. That's the key, right? Is you got to find a sunscreen that you love and that you're going to wear every single day. So it almost doesn't matter as long as it meets the bare minimum cutoffs for me. I'm not going to push any harder than that. So that means SPF 30 plus. That means broad spectrum. Water resistance if you're going out into the water. Other than that, I don't care what chemicals in it. I don't care if it's zinc oxide or titanium dioxide. I do have preferences personally, but as long as you are wearing a sunscreen that's SPF 30 plus and broad spectrum every single day, that's the best sunscreen for you.
And this is why I always, when I talk about the ones I like, I always preface it with this is an active sunscreen. And I think I made up that term. I'm not sure, but I think I did.
I'm pretty sure it says on the product labeling active sunscreen.
No, pretty sure that's not true.
I'm gonna find one just to debunk you.
No, they say sport. Active's totally said something completely different. But anyway, but the reason I say that is because, yeah, the ones for daily use really probably will have a different profile than the one you're gonna wear when you go to the beach for like half a day, you know? So again, just be deliberate, be thoughtful in everything you're doing. Your everyday sunscreen, you've gotta love it. Your active sunscreen, you've gotta love it because you gotta wear it. All right, so this is something, every time it comes up, I cringe a little bit. Videos of people popping pimples, people popping cysts, but just pimples. Tip number 4 is leave your pimples alone. And the reason I say that is because the most important thing I think when I'm treating a person's acne, one of the most important considerations for them long-term is we've got to prevent scarring. That's what's going to stick with you past your acne years if you grow out of it. And so when I say this, I want you to not mash it. I want you to not pick it with needles. I want you to not curettage it. But there is a time where that's okay. So the ones I think it's worst for is when you cannot see the active white head. Because obviously if you see that, you got to get rid of it. It's gross. You just want to get that out of the skin, give it a chance to heal. But when you have these red bumps and nodules under your skin that are painful, especially if you push on that, mash on that, you're just going to drive and flare up that inflammation, and you're going to make it so much worse. The inflammation is going to go so much deeper into the skin, you're going to be much more likely to develop a scar from that.
Yeah, if you think about what's going on under the skin with one of these deeper pimples, is basically a little PEC acnes bacteria with a lot of inflammation around it, but it's contained within a hair follicle. So this inflammation is all contained within this almost like a little sac underneath the skin. Now, if you pop that sac by pushing on it, you rupture the hair follicle. Now, all of that bacteria, all of that inflammatory cells, they're all going to seep out into the surrounding skin. It's going to lead to scarring. It's going to damage your collagen. It's going to take longer to heal. And so this is really important if you understand the way that works. But once it's up to the surface and you can see that little whitehead, that's when you could potentially pop it. I still think they heal better if you just leave them alone, but this is where you're going to want to use your spot treatments.
It's true. And if you need to see an example of a pimple being popped, I think there's one on TikTok somewhere. Technique is questionable.
We'll put the video up here so that you guys can enjoy this. Just so you know, I get pimples all the time. So this idea that, if you have the perfect skincare routine or you have a really good skincare routine that you're never going to break out, definitely not true. So tip number 5, good skincare is going to take some time. You got to really be patient with it. And I've said this before, it was one of the things that I hated the most about when I started skincare. I immediately wanted to see results. I was like, why is my skin not better day to day? I was looking way too closely from day to day to see if there was any improvement. And that's not really how it works. Our skin takes time for those skin cells to turn over and bring in healthier cells. And so when we see patients in clinic, especially, with acne, we set specific timelines for them. So we see them back in 2 or 3 months because we know that in 1 month, you're probably not going to see results. And so there's really no point in seeing you back in a month. And we say, hey, stick with this routine, trust in this routine for 2 months. We'll see you back and see how you do. If we need to make adjustments, we'll make adjustments at that time. And so for something like acne, it's going to take 2 to 3 months. And it's important to set realistic goals for people because if you don't, then after a week, they're going to give up on their skincare routine.
Yeah, and there are so many conditions where time is so important. I think so Dr. Sean and I were talking a little bit before, and just moisturizing is one of the things that you'll see an immediate benefit from. You moisturize your skin, you'll see a benefit obviously that day, right? And there are a few examples, like you talked about, acne can take 2 to 3 months, not only with your topical treatments, but when you come to the doctor's office and you get systemic medications like antibiotics or anything else for this acne, it still actually takes 2 to 3 months to get the maximal benefit from that. And then other medical conditions like psoriasis, same deal. Even if you're using like a really select, targeted, very, very effective medication for that, still 12 weeks is the endpoint where you're really going to get the maximal benefit from most of the medications.
Right. So knowing the timeline is important. Like we said, moisturizers pretty quickly. Exfoliants, you usually see a result within a week or so. Things like retinoids, you're talking about 3 months, especially for things like acne. 6 months for anti-aging. Hyperpigmentation can take 3 to 6 months to see improvement in. Red spots or post-inflammatory erythema that you get after your acne heals, that can take a few months to heal as well. So just setting realistic goals for your skin is really important.
Very.
So my tip here is to take a photo before you start a new skincare product, or before you start a new skincare routine, or before you start an acne treatment, and don't look closely again for 2 months, and then just take a photo 2 months later and see how you did. Because a lot of people, what they end up doing is that they start a skincare routine and they actually start to look closer at flaws that maybe they didn't even notice they had before. They're looking in 5x mirrors, 10x mirrors, they're seeing their pores look large, and they start to notice imperfections that nobody else can notice except for you. And so what I would say is take a good photo, same lighting, same angles, no filters, one day, and then wait 2 months, take another photo and see if you see improvement. And that's when you're going to really be happy with your routine.
All right, tip number 6, the last one. This is let your skincare age with you. So we talk about this in passing in a lot of our videos, just, the same things you're treating in your teenage years, that's going to change as you change. In your 20s and 30s, your skin is going to change. And then in your 50s and 60s, your skin is going to change a lot more again. And so let's say you're treating acne in your teenage years, you have a retinoid, you have benzoyl peroxide, you have azelaic acid. Some people grow out of their acne, a lot of people grow out of their acne, and so now you can lose the benzoyl peroxide as you advance into your 20s and 30s. You can keep the retinoid, you can keep the azelaic acid, because here you're treating dyspigmentation, you're going to treat collagen growth. Both of those can stay. And then you can add in something like an exfoliant, something to help remove some of that dullness from the top of the skin. Again, add another step to help stimulate collagen growth. Then you get into your 50s and 60s. We actually get a lot of questions about aging skin. At some point, we really do need to address that for people who are getting into those later or more mature years. But you stop making natural moisturizing factors and other natural moisturizing oils. And so at that point, you can keep some of the collagen growth things, but you're really going to be introducing a lot more moisturizers, a lot heavier moisturizers with more oil content to help replace what your skin isn't making anymore.
Exactly. So as we age, our skin starts to turn over slower, we start to produce less oils, and you really need to start focusing on moisture as you age. And we'll go into basically different routines, I guess, based on age groups, and that's really going to depend on you, but things sort of change as you get older, and you need to be able to, like you said, kind of grow out of them and mature out of them and be adaptable in your skincare routine. Your skin may actually change by seasons. In the summer you may need to use different products than you use in the winter, and so all these things are very adaptable. You don't need to change. Your products don't stop working over time. That's a common misconception. So is your retinoid going to stop working? Is your exfoliant going to stop working? No, the products are going to continue to work. The thing is that your skin is going to change with time, not necessarily the products or their effectiveness. And the other thing that is and we'll talk way more about this at some point when we talk about things that cause allergy, but you can become allergic to something at any point. This is so important.
So
and
important.
Nobody will believe you when you say this. And patients come in all the time and I'm like, you're allergic to hair dye. And they're like, no way. I've been using hair dye for 12 years, same hair dye, nothing's changed. I've been using the same detergent 20 years, nothing's changed. And I'm like, listen, this is something I didn't even believe in at first. I'm like, how is this possible? How does this happen? But when you understand how our bodies sort of work with the immune response, is that one day they basically just decide, I don't like this molecule. I don't like this product anymore, and I'm going to mount an immune reaction to it. And that's how you develop allergy. So it can be a product that you've used forever, and you can develop an allergy to it, and you have to remove that from your skincare routine at some point. And so you have to be adaptable at all times. And so you can become allergic to something that you've never been allergic to before and have used for many, many years.
All right, and all these adjustments and these dynamic things about skincare, that's kind of the fun of it. That's what makes this such like a kitsch thing that you guys can do at home, that we can work with you on doing. There's a lot of variables. Sometimes it's like exciting actually to ditch a product and get a new one. I mean, it's actually very exciting for a lot of people to get new products all the time. So this is just like a reasonable excuse to make some changes.
All right, so those are our top level skincare tips, and we'll be doing more videos like this. We get little gems of knowledge. We learn on social media from all of you, that we learn from other people, that we we learn from our mentors and we learn from our patients. And so as we learn new things, we'll let you guys know. You know, we're democratizing basically skincare education and dermatology and trying to give you guys the best information possible. So thank you guys so much for tuning in.
Yeah, we greatly appreciate you. The feedback is always great. It's so fun to interact with y'all.
Your comments are the best. We love the
Some
comments.
of them are ridiculous. But they make us laugh. A lot of them make us
They
laugh.
do. We screenshot them to each other, like especially if you roast Dr. Maxfield, like definitely I'm sending it to the whole office. So thank you guys so much for tuning in. Please like, comment, subscribe potentially, and let us know if you guys have any other ideas for us.
All right. Thanks, guys.
I'm gonna laugh this whole video.
Ready?
They should do like those debate, you know, the debate calculators where they say how much talking time each person got.
People, not right now. That wouldn't be good. they'd be like Dr. Shaw, Dr. Maxwell. But I'm a listener. Even in real life, I'm like more of a
now
listener.
you're a listener.
That's my wife. I just like
Smolder. What happened? Did you zone out?
no. I had like I had a thought that I'm like, oh man, this would be. I totally agree with what he's saying. There's something I want to say, and then it like just 100% drowning on the shore.
You almost killed me one time when we were surfing, so.
Maybe I'll just tell it to you. So Shaw, okay, it was a big day. I'm surfing. He went out with me, and like he had just moved to the beach, and these waves were big. They were overhead, and I see him out in the waves, and waves coming over his head, and I hear, ah!
I did not scream. Okay, that's not,
It was
a total
very
fallacy.
It was a very deep scream, like ah.
Okay, listen. What happened was, I don't know if you guys have ever been out and deep in the ocean, but what happens is you get hit with one wave, right? But it's never just one wave, right? Because then it's like always like a series of three. So I got hit with one wave, barely caught my breath, got hit with the second wave, and then the third wave.
It's so true.
Now, I can't swim really well. It's a well-known fact. I can swim, but I can't swim well. Like, I'm not like an Olympic swimmer. And so I panicked a little bit. No screaming involved. I was very calm.
I heard it before I saw it. But I have to give him credit. Actually, I gave him a lot of credit. I think as soon as after it happened, I was like, man, he's brave. I wouldn't have gone out in these waves if I hadn't been comfortable.